Well, hello everyone, and welcome to our little poster presentation. As you can see, we used for the poster an abbreviated title. The full title of our paper is the Automated Detection of Adverse Drug Events, which is ADEs, from all the patient's electronic medical records using text mining. And this is precisely what we did. The work that we describe in our paper is part of a much larger project called the SwissMADE project, which is the first attempt in Switzerland to use electronic patient records in large scale. So more precisely, in the SwissMADE project, we have ourselves a large collaboration of various hospitals and research groups in Switzerland, with the idea that the hospitals provide the patient data and the research groups perform the processing of that data. So in the paper that we present here, we describe the work that our group did, that is the Department of Computational Linguistics at the University of Zurich. And our group was responsible for processing the data that we received from the USZ, the University Hospital of Zurich. Now, as I mentioned before, the SwissMADE project is the first of its kind in Switzerland, and what we originally thought would be a straightforward deal where the hospitals provide the data and then the research groups do the processing of the data. It turned out to be much more complicated because it had never been done before. So the hospitals, for technical and legal reasons, could not easily extract the data, and then we spent a majority of the time of the project, which we originally had thought we could use for actual NLP work, on anonymization. That being said, in this vein, the SwissMADE project serves as a first foray, or as a paving the way for further research, because now the hospitals have set up the ways how they can in future provide data more easily, more readily. So in our case, we received from the USZ 18,000 reports from patients which conform to certain criteria. Now, the extraction of the data is one thing, but because the data comes from the hospital and needs to be transferred to a research group, so it has to cross institutional boundaries and is thus protected by Swiss privacy laws, it also needed to be anonymized. And luckily for us at the USZ, at the hospital, there was an independent project already in place that aimed at automatically anonymizing patient reports so they could be used for research. And in fact, the SwissMADE project and our group, we served as a first stakeholder for that anonymization project, and were able to provide feedback on the accuracy of the anonymization and the usability of the data. So after 1 year, everything is done, and we receive those 18,000 reports anonymized in such a way where a system of manually crafted rules would detect personal health informations and replace it from a list of plausible candidates, thus hiding potentially missed entities. So, for example, if a name is not found by the anonymization tool, it becomes indistinguishable from the names that were found and replaced by plausible candidates. Now, the reports that we received, they contain a structured section, which we use to generate a dictionary of all the drugs that were administered and all the diagnoses that were issued in the reports. And then this dictionary we employ using OGER, which is our own dictionary-based entity recognition tool, to find mentions of those drugs and those diagnoses in the free text sections, which so far have not been processed. So in a previous research, we were able to show that OGER performs actually quite well, especially when used in conjunction with BioBird. In that case, we retrained the BioBird on the graph corpus and ran OGER and BioBird in parallel. And then in the end, harmonized results of those two runs using the IDs that OGER provides, using its dictionary-based approach, in the case where the BioBird model only provides a span and does not find an ID. So now we're at the point where we selected 400 reports for a manual annotation, and we will use those annotations to evaluate our automatic annotations and check the efficacy of our pipeline. Well, thank you for your attention and have a great day.